Do you suffer from voices? If so, do not give up hope. Let us show you another way. In the 2 weeks since that therapy has been given, I have not had any voices. No intrusions, nothing I can make out at all. For the first time in 23 years, I'm voice free.
Well, thank you all for coming today. What I'd like to do today is what I consider to be something that's very, very important in educating psychiatry. Today I have just two simple objectives. One is to relieve a person of the distress from hearing voices. And sitting with me here, his name is Mike. And so that is the primary objective, to help this man. The other objective, the bigger objective, is to record, for educational purposes, an approach that can be used to tackle this problem. It is completely different from what traditional psychiatry. There are three ways I can do this. If we take the situation where you have a therapist and a patient in a one-to-one situation, face-to-face, that is one way of doing it. In order to achieve a good result using this one-to-one relationship, the therapist needs to have certain psychic abilities. He needs to be clairvoyant. He or she needs to be able to communicate with spirit, because we are dealing with a spiritual dimension here. It is suggested by some practitioners that this way of working is the intuitive method. You have the intuitive, the psychic, mediumistic therapist. Now, I'm not mediumistic, I'm not intuitive. I do not see or hear spirit at all. So I can only work one-to-one with the client as completely blind and completely deaf. So the only way I can understand what's going on with them is to ask them, to describe to me what they're experiencing. And you'll see me working this way in just a moment. A second way of working is with the help and advice of a spirit guide. And for that, we need to be mediumistic. And here we've got Andrew sitting here. He's the medium. And he's in constant contact with his guide. More than one guide, there are spirit helpers, and he has direct access and can communicate with them directly. So I may need, if I get stuck at any stage, I may need to turn to Andrew and say, what do the guides say? I need some help here. So that's the second way of working. The third way of working, which is very, very, Andrew and I work in this way quite a lot, is called the remote method. And this is where we have no direct contact with the client at all. They're in another space, many, many miles away. And the work is done remotely by clairvoyance and by telepathy. We won't be demonstrating that method today, but we do have here with us some people who have allowed family members to be subjected to this method of treatment, and we will have an opportunity today to listen to what they have to say about that method. So that's what today is about, briefly, and I'm going to end the introduction there and sit down and engage with Mike, who's come along. Now, I don't know very much about Mike yet, apart from the fact that he's an ex-soldier. I want you to describe to me these voices you hear.
Right. These voices, first time, well, they've been going on for 20 years. The first auditory hallucinations that they're described as was weapons cocking and Morse code. Accompanying that with the voices. Now, on and off, they've been really prevalent. When it got to around the year 2000, there was about 5 or 6 voices that I could hear. I went for a walk one day, and there I was on a canal path, and I could locate by the sound of them whether they were 10 feet to the left, 4 foot to the front, 20 foot behind me. Where these voices were shouting at me, I could actually turn my head knowing whereabouts they were, but I couldn't see them. But that's what it was like when it became really apparent, and ever since then I've suffered with them really badly. They are detrimental. They say a lot of negative things about my character and personality, about my life, and they intrude on, even when in my conscious state, my waking moments, by provoking thoughts along lines that I wouldn't normally entertain. So if they say a particular word or something, it distracts me from what I'm doing, and then they end up going down the road of negativity that is associated with these voices.
Okay. Do any of these characters with these voices, do they have identities that you're familiar with?
No.
So they're strangers to you?
They're strangers. I have my suspicions. I've come across, being ex-army, I've had colleagues that have died in the past, and I've explored that possibility that it could be them, or people that have been in vicinities with that have died, and it's not.
It's not them.
They just seem strangers.
Nobody you know. They're strangers.
Yeah.
It's like being followed around by a band of strangers.
That's what it's like. It's like being followed around by the paparazzi who are continually going on at you,
And you can't see them.
I can't see them.
Okay. Do you think any of these owners of these voices would speak to me?
I don't know. That's something.
Would you like me to try and speak to them?
Can try, but I very much doubt it. I'm thinking that I might have to go into some kind of trance where but I don't know whether it's come from my subconscious state or the voices, so I wouldn't know.
So you and I are going to do some work now. I'm just going to ask you to focus your attention.
Okay.
All right. And that's the easiest thing in the world to do. And what I want you to do is just focus your attention on your feet on the floor. Feet flat on the floor. Feel the firmness of the floor beneath your feet. Put your hands on your lap so I can see your fingers, because I may need to use your fingers later. Don't know yet. And I want you to be aware of the weight of your body in the chair. And just feel comfortable where you are. Now I want you to use your creative imagination and imagine that there are roots extending from the soles of your feet into the floor and through the floor and into the earth. That's right. It may help you if you close your eyes. It helps to focus your attention more easily. So just imagine those roots going down into the earth and connecting with the energy of the planet so that you're connected with the earth, and feel that energy of the earth coming up those roots and forming a solid platform beneath your feet. You can feel the firmness of the floor beneath your feet, and I want you to feel the connection with the earth beneath your feet, connected and grounded. This is what we call grounding.
Okay.
Now I want you to focus your attention in the middle of your body at your heart center. We have energy centers in the body. We call them chakras. Focus on your heart center. And in there is your inner light. I want you to connect with your inner light. And I want you to visualize it. I want you to imagine the heart center opening like the petals of a flower. Imagine a lotus flower opening so that the light shines forward and backwards, out through the front of your body, out through the back of your body. And now move down to your solar plexus, and there's another chakra there. There's another energy center. And just imagine, if you like, that energy center opening and the light moving from the heart down into the solar plexus, and then down further into the sacral region, into the lower parts of your body. There's another energy center there, the sacral chakra. And allow that energy from the heart center to pass all the way through, all the way down through the bottom, and connecting with the earth through your feet. Moving up now through the body, back to the heart chakra, moving up to the throat, opening the throat chakra, and up to the forehead, opening the lotus petals in the third eye. And then the crown chakra opening. There's an opening in the top of your head. And I just want you to imagine, if you can, and visualize a beam of light coming from above you, passing down through the top of your head and down through all those energy centers, right the way through your body, down through into the earth beneath your feet, so that you are connected between the light above and the earth below. Now I just want you to focus your attention on that heart center and your breathing. Just be aware of every breath you take. Don't want you to do anything with it. I just want you to acknowledge your breathing. Acknowledge each breath you take in and each breath you take out. No need to control it, but just be aware of how gentle it is as you sit there. It doesn't have to do very much because you're not doing very much physically. It's just ticking over, and every breath you take, without you even realizing it, actually relaxes you more. As your body sinks deeper into the chair and you feel more and more comfortable, every breath you take relaxes you more. And that light that's within you, that heart center, now you can visualize it, you can imagine it moving out from the heart center, outwards towards the outer layer of your skin, through every fiber and every nerve of your body, moving right the way out to the outer limits of your body, to your skin and beyond. And that light now shining all around you, like this is your aura, a glowing aura all around you. And I want you to acknowledge where you are, sitting in this room, on a chair. There are other people in the room, not disturbing you. This is a safe place. Nothing can disturb you here. And I just want you to acknowledge the safety of this place. And you now have around you an aura, a cloak if you like. It's like an armor. It protects you. It keeps you safe. And nothing can disturb you. And if there's anything that does disturb you, I'd just like you to convey to me what that is. Okay? Now, I want you to use this acute focus of attention that you now have, and I want you to imagine that you can see me from where you're sitting, you have your eyes closed, you know I'm sitting in front of you. So you're not looking at my physical body. But I want you to look at the image of my presence in your mind's eye. And see if you can describe to me what you see.
I see your shoulders and your head in a red glow.
Mm-hmm.
You seem to have an aura around you. It's glowing.
Okay, good. Move all the way down the body that you can see. And see if you can tell me if there are any changes in colour anywhere.
Yellow towards your midriff.
Mm-hmm.
Maybe green towards your legs.
Okay. Well, good. Now what I want you to do now, Mike, is to imagine that you're sitting where I am and you're going to look at your own body and your own aura. Okay. I want you to tell me what you see.
Kind of muddy.
Muddy, is it?
Yeah.
Okay. Move down your face, down to your shoulders, your chest. Tell
You
me
can
what.
see white and gold,
Okay. Moving further down your body, lower body. You see anything?
reds, greens.
Okay. Let's move up to the top now, back up to that muddy area in the head. Yeah?
Kind of black and dark.
Okay. Does it have a voice? What do you think? Yes or no?
I think it does, but it's not saying anything.
Okay. Well, let me ask this energy if it would like to communicate with me. Yes or no? What are you getting?
Kind of fear.
A kind of fear
Yeah.
coming from this dark energy.
Yeah.
Okay, well, let me try to allay the fears of the dark energy, because I don't want to cause it any harm. I want it to be free. So if this dark energy is trapped in some way, would it like to be freed from its fear?
Yes.
It would. Okay. Would you like to talk to me to help me free you from your fear? Yes. Okay. Do you have a name?
It's having a battle
It's having a battle.
Yeah.
Who's it having a battle with?
with me.
Okay. Why is it having a battle with you? Does it know?
It does know.
Would it like to tell me?
I don't think it wants to go.
I'd like to know why it doesn't want to go. What's it afraid of? Is it afraid of something? Okay, now I want you, Mike, to be the mediator in this, okay? I don't want you to be affected by this in any way, okay? You are the medium that allows me to communicate with this energy form, okay? And I want you to help me release it. Do you understand?
Yeah.
Okay, good. So I need to understand what energy form this is and how I can help it. If it's having trouble, if it's having a battle with you, and it's got something to be afraid of, it wants to be released, then I'm here to help. Does it understand that?
Yes.
Okay. What I'm going to ask this energy form to do is to look within itself and look for its own spark of light. Can it do that? What's it doing?
It's like a dark eye.
It's like a dark eye.
Yeah.
Okay.
It's just watching. It does want to go.
It wants to go. Okay, so I want this energy form to look within itself and to see its own light. Can it see its own light? Is it looking? Does it find its own light?
It's just dark.
It's just dark. Yeah, go on.
It's just sat there. It's the light that's at the top of my head,
Okay.
but it's in a dark form. It's presenting a kind of eye that it's watching. It's not saying anything.
Okay, now I don't want to spend too much time on this. I don't want to waste any valuable time that we have. So what I'm going to do is to ask our guides to intervene and move this dark energy form to a place that is appropriate for it to be. It may need to be educated, it may need to be confined, it may need to return from whence it came, but without information from it, we don't know what form it is. I will leave that to the guides because they will know what to do with it. And I'd like you to tell me, Mike, when it's gone. Tell me what you see.
I just feel tired.
You just feel tired, do you?
Yeah.
Okay. What do you see? Is that energy form still there?
I think it's draining me.
Okay.
It's there, but it wants to leave.
Okay, well let's... Is there anything preventing it from leaving?
It's upset at leaving.
It's upset at leaving, is it?
It is that way. Like it wants to go, but it's not. It's kind of lingering. I can see beyond, in the gaps between it, there is light there as it tries to move away. But it's shrouded in a kind of dark light that is.
Okay. Now I wonder if this is spirit of human form, human origin. Because if it's non-human origin, it doesn't belong with you at all. So I'm asking the guides just to gently ease it away from you. I'm asking the guides to disconnect this entity from you, to remove the connections, so that light can come in and repair the damage that it's left behind. I want you to feel that light coming in.
It's going.
It's going. Good. And I don't want you to be drained of energy. I want the energy to come back into you. I want you to feel well. And if you feel any distress or any disturbance or any discomfort at all, I need you to tell me what it is you're experiencing, okay? Let me know when that dark energy's gone.
I'm kind of willing it to rise.
Could you speak a little bit louder for me?
I'm willing it to rise. It's going.
Okay.
Seems reluctant.
It seems reluctant.
It's going.
It's going. Good. Okay, good. Let it go. And I want you to now just remind yourself that you're sitting in the chair in this room with your feet on the floor. Okay, and I want you to bring all parts of your consciousness back to your heart center. back to this room, back into your body. And on the count of 3, you'll open your eyes and return to normal waking consciousness. 1, 2, 3. Eyes open, wide awake, and feeling perfectly fine. How long did that take?
About 20 minutes.
How many?
About 20.
20 minutes.
Mm.
Okay. Yeah. 20 minutes. Goes fast, doesn't it? So what have we learned today? We've learned how to go into an altered state of consciousness.
I was aware though.
Of course you were aware. Of course you were aware. Or did you think you were going to go unconscious and not remember anything? This is the misperception
Okay.
about the altered state of consciousness. You don't lose consciousness at all. In fact, your consciousness is finely tuned and more acute.
Yeah, you reach relaxed state, don't you?
Yeah. So you're in a physically relaxed state. You're in an emotionally relaxed state. And your mind is able to focus accurately on one thing and not be distracted.
Yeah.
Right? And that's what it's about. It's all about the focus of attention.
Okay.
So what you've learned today is how to go into an altered state of consciousness. You can call it hypnosis if you like, but you don't have to, because the very word hypnosis gives people false impressions of what it's about.
Okay.
So you've been in an altered state of consciousness where the focus of your attention is removed and dissociated from what's happening in this room. You've gone inside.
Okay.
All right? And you've been able to visualize putting a protection around you, a spiritual protection, and strengthening your aura.
That was the easy bit.
It's easy, yeah.
Doing that bit is negotiating what was going on up here.
Yeah, that's the hard part. Yeah,
Hard part.
yeah, because it's strange. It's new to you. It's a new experience. Right?
Okay.
So what you've learned to do is how to put a spiritual protection around you, ground yourself to the planet, right? And protect yourself with your aura. And then you've been able to scan your own energy field
Yeah.
and pick up something that doesn't belong.
Yeah, it definitely doesn't belong.
And that is very definite, isn't it, when you discover
yeah,
that? You go,
yeah,
"Ooh,
yeah.
well, yeah," right? So you've learned how to do that for yourself, right?
Yeah.
And what we're doing here is to demonstrate for therapists and psychiatrists and practitioners how it's done.
Okay.
It's simple, isn't it?
Yes. It's simple getting into that state.
Yeah.
The difficulty is in, the gubbins, negotiating with the gubbins that you feel is.
Yeah.
That's the difficult part.
Yeah. Okay. So now we can do that. We can negotiate with them and enter into dialogue with them, or we can just say to the guides, "Deal with this."
I don't actually feel like I'm in a trance now, to be honest. I feel relaxed, in a relaxed state.
Yeah, but it's a light trance. It's an altered state.
Yeah.
As I said before we began, the important thing is that you are able to focus your attention.
Yeah.
And the fact that you focused your attention and you picked up a dark energy, and then it responded, and you felt your energy draining,
Yeah.
right, is confirmation that you've picked up on something that is important, that's relevant.
Yeah.
Now, you wouldn't have been able to pick that up in going about your normal day-to-day business because your mind is not focused at that level. So it's an important lesson, it's an important part of the process to understand that you have this ability, and we all have this ability, to shift the focus of our attention inward and do a self-search body scan. And I've worked with people who don't know they have abilities, and I've suggested to them, and again you can put it down to the power of suggestion, but at the end of the day you've got to ask the question, did that make a difference?
Yeah.
And I've asked people to use their power of internal vision and focus of attention, and imagine that their mind is a higher powered electron microscope. Now, you may not even know what an electron microscope is, but it doesn't matter. Because when you suggest to someone, use your mind in that way, they just do it. And I've had people focus their attention and go in at the microscopic level and actually uncover the cause of involuntary spasms in the nervous system. In Tourette's syndrome, for example, where they visualized and saw and described neurons misfiring.
Okay.
They can't do that with normal eyesight, but the mind can do it in focused attention. That's just the power of the mind.
Yeah.
And it's the powers of the mind that we are not taught, and we don't realise we have. So all you've done today is to learn how to focus your attention inwards and detect energy within your etheric body that doesn't belong there.
Yeah.
And everyone really needs to learn how to do this. And every doctor and psychiatrist and clinical psychologist needs to learn how to do this so that they can help their patients be cleansed at the etheric level. That's what you have a gang following you around, a gang of voices.
Yeah, definitely.
They've been there for 20,
A good 20 years, yeah.
and you don't know how to get rid of them.
No,
Right, well, let's get rid of them for you, shall we?
that's the plan.
What what I'd like you to do is to assume again this altered state of consciousness.
Okay.
And I just want you to describe to me what you see. Right? I want you to be my eyes and ears. I'm blind and deaf, but you can see and hear what's going. You hear I don't hear these voices, you do.
Yeah.
Right? So I want you to describe to me what you hear and what you see. So I just want you to put your feet back where they were. And your hands on your lap. And just close your eyes. Focus on your breathing. Listen to your breathing. And just acknowledge every breath you take. Every breath in and out. And just feel comfortable sitting on the chair. Firmness of the floor beneath your feet, and ground yourself with those roots through your feet. And just check the integrity of that protective aura around your body. No need to go through the whole process again, but just put that protective aura in place around your body. Connect with the light above. And just be still and rest, listening to your breathing. And I just want you to report to me what you sense, what you see, and what you hear. These voices that trouble you, are they around?
Yeah.
Are they?
I can sense them.
You can sense them. Are they saying anything?
No.
They're quiet.
Yes.
I wonder why they're quiet. Are they hiding?
Yes.
Okay. Would you like to see them?
Yes.
You would? Okay. Well, then look around. Look around and see if you can pick up their energy signature, their energy frequency. See if you can tell me if there are any shapes, colours.
Yes.
Tell me what you see. Just describe to me, if you can, what you see.
I can see or sense 3 maybe at least 3
Mm-hmm.
kind of entities, for want of better words.
Okay, do they have any kind of form?
They appear like scars
Like scars?
in dark flesh.
So they don't have an animal or human form?
No,
They look like a scar?
I look like a scar on my brain.
Really? Okay. So what are we to do with these? What would you like us to do with these?
To go.
You want them to go? Okay, well let's have them taken away. Let's have them surrounded by light. Let's ask the guides to come in. Net of light, catch them all up, bundle them all up together, and cart them away. I want you to describe to me what you see.
I see my brain, I see growths on the brain surrounded by light. The growths are dark and the light is swallowing them.
Good. Tell me what else you see.
I'm aware of light,
Where's it coming from?
my brain,
Okay.
they're diminishing.
Okay. So the light is driving them out.
Yes,
Good. Let me know when they're all gone. Or if there are any problems, any hanging on.
1, 2 hiding, but I can see them.
Good,
They are dissolving.
good. I want you to have a really good look round now. Look around what you're seeing, what you identify as your brain. Look in every nook and cranny. See if there's anything hiding, anything skulking. Actually, in your mind's eye, you can open it up and look inside. Would you like to do that? You're doing it. And see if there are any traps put inside to trip us up.
They are losing.
They're losing, are they?
Yeah.
Okay, good. Can you count them? Were there many?
There are many. Or several big ones and residue from others.
Okay. So we've got a clean-up operation in progress now. We're asking for these negs to be swept up and carted away, detached. Let's ask for the cords that enabled them to connect with you to be dismantled and unplugged. Let us ask for the damage that they've done to the aura to be repaired and sealed so that they can't come back. And let us ask for, one of my favourite devices is what I call the cosmic vacuum cleaner. It's God's vacuum cleaner. Comes in and sucks up all the negative dross that's left behind. Sucking it all up and dragging it away. And now we can also use the cosmic flamethrower and do a real proper clean up and burn out anything that's left. Burn out all the residue.
It seems freer.
Okay. What we're looking for is for pristine.
I'm getting a bright light. I'm visualizing a bright light
Okay,
surrounding my mind.
okay.
The debris seems to be going or gone.
it needs to be left in a pristine condition, shining, bright, clean, repaired. And you also need to be feeling that cleansing. And I'd like you to tell me how you're feeling.
Feeling I can visualize I like my body and my mind, and it doesn't seem detached now, it seems one. It's bright.
Good. Now I'm wondering if there's anything else that needs to be attended to here. I'd like you to tell me if you feel confident that all this negative energy has been cleared away.
I think I am.
Okay.
The negative energy is going.
Not gone yet.
Like my own personality has a dark side, but it's not sinister.
Okay.
Not like how the voices were.
Okay, good. Well, that's something we can perhaps attend to in another time.
Yeah.
Okay, good. Now, so while we're here now, while you have this acute focus of attention, I just want to explore the possibility that there are any other human souls earthbound around. Are there? Do you detect any spirits around?
I think there's one.
Okay.
It's weeping.
It's weeping. Is it male or female?
Female.
Okay. Does it have a name? Does she have a name? Don't know. Is this a woman or a girl or
A woman.
a woman? I'm asking the weeping woman. Sounds as if you need help. Do you need help?
She's nodding.
She's nodding. Okay. Well, let's help you. Would you like to tell me your name? Tell me your name. Let us help you. What does she say?
She's upset.
She's upset, of course. Yeah, we know she's upset. Yeah, but we'd like to help.
She won't give a name.
Okay. Is that because she's afraid?
It says conflict with me.
Right. So what are we dealing with here, Mike? Is this, what's the nature of this being?
Sorrow.
It's sorrow. Is this part of you?
I don't think so.
See, what I'm looking for here is just searching in the area around you to see if there are any other spirits that are earthbound and should be with the light. That's what we're really looking for.
She's turning away. Whether she's going into the light. But she's crying.
Well, if she's going into the light, that's okay, because she won't be crying for much longer if she's going to the light. This is where the guides come in useful. This is where guides, because I can't see. And I need to be able to communicate with stranded and trapped earthbounds. And sometimes the mediumistic abilities of the client may not be up to that. So this is where the guidance comes in helpful. So I'm going to ask Andrew and Chen here. Do we have an earthbound here?
Mm-hmm. Yeah, we do.
Right. Can you get a name for me?
Yeah, so the name she's presenting is Samantha.
Okay. Hello, Samantha. Do you want some help?
Okay, so she's saying yes/no. Depends what you're offering.
Well, Samantha, are you happy where you are?
So, okay, so she's saying she's not happy, but she's comfortable.
Okay. Are you supposed to be here?
Okay, so she doesn't know the answer to that, but she's saying that she likes Mike's energy and therefore she's interacting with him on an etheric level.
Okay. What I'd like to find out from you, Samantha, is what happened to you at the end of your life. Can you remember?
Okay, bear with me, start a bit.
You're picking up on the emotions.
Yes.
Yeah. Step back a little bit, yeah, and let her convey to me what happened. If she can step back and be a witness to what happened rather than experiencing it again.
Yeah, just disconnecting myself. I'm seeing and feeling where we are. So I can see basically a city that's in bits, that's being, it's in a war zone somewhere, and she has her children with her, and they're running through roads basically from battle scenarios.
Okay. Can you tell me where this is? And when?
Okay, I'm just asking now. So now she's speaking to me in a dialect that I don't understand, so
Okay.
I'm just asking to be shown symbols that I would understand.
Okay.
Okay, so it's like Slavic type
Okay. So, right. Okay.
situation.
This is something that Mike's picked up, in his military career in the Balkans, perhaps.
Yeah, okay, so she's saying that he's not the result of where she is.
No.
He was in the appropriate area, basically.
Right.
So she's saying after she passed with her children,
Mhm.
because they all passed at the same time,
Mhm.
they were left wandering around, and Mike, in passing and being quite energetically light,
Yeah.
has attracted them
She
to
was
him.
drawn to him, yeah, because of his light.
Yeah, and
Yeah.
she's saying that he's a lovely guy.
Well, yeah, he is a lovely guy. But Samantha, when the spirit leaves the body, it really does need to go somewhere else. Some people call it heaven, some people call it paradise, but it's a much nicer place than where you are at the moment. And we'd like to help you find your way there.
Okay, so she's just showing me now behind her is a whole raft of different discarnate earthbounds.
I'm sure
basically.
there are.
So we're talking like hundreds as opposed to
Yeah,
tens.
well, this is a war zone, isn't it?
Yeah, yeah.
We had this the other day with another case, didn't we?
Yes, we did, yeah.
So,
So she's saying to me that she knew she needed to leave, but her children had connected with Mike,
if
and
they,
therefore she stayed on the basis that she couldn't separate the two, if you like.
no, of course not. Okay, well, she needs to take her children with her, doesn't she?
Okay, yeah. And she's also the forefront in terms of speech for all of these other
Okay.
discarnate energies, basically.
Okay, so what we need to do here, correct me if I'm wrong, we need help from the guides here to take Samantha back to the circumstances that she found herself in with her children, where she attached to Mike. We need help with the guides to take her back there to reconnect with her own family and her own people who also suffered this war, and collect them all up together and enable them and escort them to where they should be in the light. Can we arrange for that to be done?
Yes, I've just asked Chen to basically facilitate that.
Okay.
So I've opened a door to the other side to the light, and asked each one of them to go through and find someone appropriate that will collect them.
Okay.
She's still talking to me, and she's saying that she wants to apologise to Mike, basically. One, because they know that they fed from him energetically, which is why he's very tired and been struggling. And she's saying that the visions that he's had from the war zone, the PTSD aspect, is from their experience, not
Right.
his. So she's saying that we know what he's reliving in dreams and in those thoughts isn't really his own experience, it's through the people that were living in the war zone at the time. And she's kind of apologising that he's had to endure that experience,
Right.
because it's obviously been very traumatic.
Okay, but that's very, very useful to know, isn't it, Mike?
Mm-hmm.
Will this make sense to you?
I would have said no, but you know, I was in the Balkans, and
Mm.
I never mentioned that to you, Andy.
Not to me, no.
Fair one.
Okay, so this situation can be resolved now then? Anything?
Okay, so they're all going through, so she's just holding back just to finish off the conversation,
Okay.
basically. So she just wants me to say to you that from their aspect and their angle, they would like to say thank you for allowing them to be free, effectively. Because she's saying that's what's actually happening, is that they know they're in the wrong place and they don't really want to be connected to a human, especially when they realise that they're having a negative impact on his life.
Right.
And they're saying that, you know, we are sorry, but it's how it is, if you like.
Well, there's no need to be sorry, and there's no need to thank us in that way, really, because we are here to help. We're helped. We are here to educate and help other people understand. So I'm thanking you for helping us understand, Samantha. So thank you, and thank you for explaining everything to us. Thank you for helping us educate others, and have a safe journey.
Okay, of course, so she's going on that basis.
Okay, good.
But she's just saying to me that as soon as she disconnects the last connection to Mike's etheric, he's going to feel
Different.
better, basically.
Okay,
Because obviously he's been very, very physically drained.
okay, good.
So that's done.
Okay, so we've done quite a lot of work today, and whilst I've still got you,
So yeah, it's
and
just,
Chen, is there anything else that needs?
yeah, it's just still a no.
Is there?
Yeah. I can hear it talking to me.
Okay, what's it saying?
Well, it's just laughing that it's been missed, effectively.
It's just shown itself. Stupid Nick.
Can you hear that, Mike? Can you hear this conversation?
No.
Okay. Are you aware that there's anything else around you that doesn't feel quite right?
I'm just tired.
Do you want to deal with that for us?
Yeah, I'll just whip them off. So I'll just basically connect to it, cut the cord that's connected to Mike, and then pass it to change remove.
Mm-hmm.
So that's done now. So now what I do is a sovereignty check basically on Mike's etheric field. So I just ask 3 times, is Mike sovereign, yes or no? Is Mike sovereign, yes or no? Is Mike sovereign, yes or no? So I've just done that. I've got 3 yeses so that I'm comfortable there's nothing negative attached to him. And now that we've dealt with this kind of aspect,
Mm-hmm.
from an etheric perspective, I can see that his etheric field is now clear completely.
Good.
And Chen's confirming to me that what I'm seeing is what he agrees with. So we're both happy with that.
Okay, good. Well, thanks, Chen, for that, and thank you. And what we've been able to demonstrate today is the value of having someone close by who is psychic, who is a medium, because it takes that degree of sensitivity and the ability to communicate in order to reach these levels of consciousness. So, Mike, what I'd like you to do is to bring yourself back very gently back to normal everyday consciousness. Do it. Follow my instructions. Just focus your attention on your feet on the floor, and feel yourself grounded to the planet. Feel your body sitting in that chair, and you are back in this room. And on the count of 3, open your eyes and return to full everyday waking consciousness. 1, 2, 3. Eyes open and wide awake. And just take a few moments to allow yourself to process and accommodate what you've just experienced have a little rest. So that's how it works. What we try to do in the first part of the exercise is to get the person into a state of consciousness where he is able to access his own spiritual energy field, his etheric body. And there are varying degrees of success in doing this. Some people find it very easy, others find it very, very difficult. And of course, it's in the most difficult cases that we need the help and guidance from a practiced medium such as Andrew. So when we are looking at and here we've got dare I say, a case that is quite typical, right? A person who's been diagnosed with post-traumatic stress disorder, has been in a war zone, and will suffer the psychological consequences of that. And then when they go for treatment, and those kind-hearted souls who do their best in counselling and treatment for this, if they don't have this knowledge, then they're not going to solve the problem. So every clinic, hospital, help centre, every resource that is set up to help people deal with voices need to learn these techniques. Otherwise, they're going to fail. So let us see now, after a few moments, when Mike has had a chance to process what he's experienced, we'll take a little break there, and perhaps we will come back and address any questions that anyone has to ask, or any comments that anyone has to add. So let's take a little break there, shall we?
Yeah, when I was on the train coming here yesterday, somebody came over the tannoy, or appeared to be over the tannoy, and just said, "Hello, Sammy." All right. So, amazed you picked that name up. Maybe that was it. I don't know.
I've got a lot on them.
Yeah, well, it's been going on for years, but I thought you when you were talking about the children stuff, there was a time in Kurdistan that really affected me, coming across the children that were dehydrated and went back in the Gulf Ops of 1991. The Balkans, what you were saying was ringing true, because even though I was in the Balkans, where I was in Zagreb, there wasn't a great deal of combat actually in Zagreb, and yet you were saying that someone had attached myself from the wider region. It kind of made sense, because you said that even though the visions that I was seeing from the Balkans were not from my own experiences, because I was in Zagreb, as I said, but yeah.
I was actually seeing buildings falling and this family rushing through the street with just pandemonium going on, really.
Yeah.
And then it just stopped, so they were all obviously wiped out at the same point in time, basically.
Okay.
And then, of course,
It made sense. And another thing that was happening before Terry engaged you, she was turning away and looking at you. I was visualising my brain, and then she was turning away and looking at you, and then you engaged Andy, and it's like you took over from there. Sorry, like bizarre.
yeah. Of course, I had already started talking to her by then. So when she turned away from you, I kind of realised that she wasn't going to play, really. So I thought I'd just say hi, and
Yeah.
they're a bit shocked then when they suddenly realise that somebody else can see them and talk to them. Because they're normally just used to talking to you or the person that they're with. So suddenly, we can frighten them the same way they frighten you and say, hi. Wow.
Should we have a sandwich?
Yeah.
Anybody fancy a sandwich?
Yeah. I've got the grub, yeah.
All done. Spiritually speaking, I'm blind and deaf. I don't hear or see spirit at all. But I'm aware of them. And the constant reinforcement I get from doing this sort of work with people, for example. people around me, as I'm walking down the street and going through the supermarket or whatever, are totally and blissfully unaware that a spirit world actually exists. It's when you get situations like this, when a person is hearing voices, thinks they're going mad, and the rest of society thinks they're going mad, they can actually be driven mad. When the reality is they're more sensitive than the rest of us.
A lot of people are actively denying that there is any spiritual reality.
Yeah.
And that is the current paradigm, where all education, most of psychiatry, most of the medical world.
I think people are waking up. It's just a lot of people, they want to stay in the comfort zone. They don't want it to be interfered with.
Yeah, I find it odd as well, really, when you've got, I don't know, quite a large portion of the population of the planet is religious to one degree or another, and all those religions talk about spirit and entities and gods, and they all pray to a god that they've never ever seen. And yet, when we talk about spirit or spirit problems with people mentally or any other way, society doesn't accept it.
Yeah.
Two don't go together at all, really, from my perspective. Religions typically go through a phase where they move into a very sceptical sort of area, like in Christianity. God is Dead was the title of a famous book by Bishop John Robinson about 1963. I mean, there's a whole lot of this Christian church now, at least in the West, doesn't believe in God at all, certainly doesn't believe in spirits, doesn't believe there's anything beyond the material world.
Mm.
Yeah, they've all got churches with pictures of angels on their windows, probably. Yeah, but that's because they're all historical legacies. They're like myths from the long past. I mean, they're not going to take the stained glass out because it looks nice. You know, and then the listed buildings people will be on their backs too. So. Yeah. Doesn't mean to say they believe in any of that stuff.
What I'm really interested in now, and maybe it's a little early because you've only just been through an experience today that was new to you.
Mm.
But you told us earlier that you'd been suffering from these intrusive voices for 20 years.
Yeah, it's a good 20 years.
And we just did some work today, and you've had a little bit of time to, you know.
Yeah, there's no. I've been listening out for them, and it's kind of strange because I'm finding no intrusions at present, and there hasn't been for a good half an hour yet. And normally in my day-to-day life, I get 2 or 3 comments made per minute. But for the past half an hour, I've been relatively. Well, it's just bizarre. It's like I'm steering the ship now.
Good. I'm just going to give you a little bit of a warning here. This comes from a case that we dealt with quite recently, you and I. I can't remember the name of the person, but this particular characteristic of the case I've just been reminded of. The voices were removed, right? But then the person wanted to check and make sure they were gone. So he invited them back to see what was happening.
Yeah, it was a spiritual young lad, wasn't it? He was quite telepathic. And he actually liked the concept of talking to voices, basically.
Yeah. So when we removed them, and then I wonder if I can get them back. And of course he invited them back, and of course they came back.
Yeah, different ones, but yeah, more
So,
voices.
Yeah. So there's a warning here. Don't test it. Don't invite them.
I don't want to. I'm conscious of that. I'm conscious of that. Don't worry.
Yes. Now you're gone. You're going to stay gone.
That's the hope.
Yeah. And also, it's over time, as time goes by, you'll start to have the confidence that you are in fact yourself, and you feel better, and you've got more energy, and you know that's what makes a huge difference as well.
Because you've spent such a long time not having full control of your own life.
Mm-hmm.
It's going to take a little while to readjust to the fact that you have.
It's very dehumanising,
Yeah.
but even more dehumanising in many ways how the psychiatric services treat you. It's quite appalling, really.
Yeah, well, tell us more.
I was sectioned once on the bogus grounds where they had 11 armed policemen surround me and my family
Really?
and take me out of the car in front of my son. My son was 2 years old at the time, 1 year old. For a number of months afterwards, when I was eventually released, when I used to leave the house, he'd cry because he didn't think I was coming back because what the police did.
Repercussions.
And that's all simply because I wasn't taking the medication. I'd made no threats to anyone. I was conducting myself generally okay. We're getting a holiday for my wife and child back to South Africa while I looked for a new house for us to stay in. That was the plan. Then 11 armed policemen. Another sad fact in all of this is a lot of people suffer mental health because of injuries sustained in childhood mentally. I'm no exception to that. And society, they cover it up. And you know, I think some of us are aware of the film Girl Interrupted and films like that. These things happen where people have their children as they grow older and the children start demonstrating problems that they have because of what they've suffered in childhood.
Mm-hmm.
Quite often the parents will have them sectioned.
Mm.
And it's not just make-believe, it's not just a script written for Hollywood, this actually happens. And the psychiatric services go along with it. And there's many people that are there who have been sectioned, who are probably very decent human beings, but they are made to look as if they are rejected by society. And it's not, a lot of it stems from problems that incurred during childhood.
But what I want to focus on now is having experienced, what advice would you give to someone who was experiencing similar to what you had?
I got in my arsenal every kind of tool I could get from people like Warrior Program, NLP. I've tried everything. And the voices have always been there. No matter what medication I've been on, Clopixol injections, Dipixel injections, olanzapine, stelazine, aripiprazole, risperidone, I've been on a lot. The voices have always been there. But for the past half an hour, after what we've gone through here, I don't feel any intrusions for the first time in about 20 years. I feel quite upset about that because I've been suffering so long, and if there are these therapies that are out there, you have to grab them. Yeah, you've got to grab them, because the way the system and the state makes you feel, what it makes other people believe of you with institutionalization, does nothing but make you feel a low quality human being. And that's appalling, because we consider ourselves the modern world, and we're not. We are modern when we encompass things like what we've done here today, not through archaic philosophies, draconian ways of institutionalization. It's not working. It's obvious. So if you can get these therapies, give them a go. They're on offer. Seek them out. That's what I'd say. And I'm saying
We've
it.
got someone else here today who has experienced what we've not demonstrated today is the remote method, where we work on behalf of someone who's not in our immediate presence, right? Remote spirit release therapy. Has anyone got anything to say about that?
Well, I've got experience of my son, he's 23 years old, and he is having mental health probably the last 5 years, and he's been diagnosed with psychosis. And last September, he was detained under the Mental Health Act as well for treatment. And I was quite shocked and realized how dehumanized is the mental health service and the psychiatrists, the way they treat people. When he was in a hospital, then when I contact Dr. Palmer and Andrew for work, before that, the day, my son was completely doped with the medication. He was presenting very aggressive. He's never been violent. He's to nature, he's very kind and polite young man. But since he's having his mental health problem, he started to get very aggressive, verbally aggressive. And the way they treat them, it just like suppress the symptoms they had, a lot of medication. And my son when he was to a psychiatric intensive unit, the only things they gave him was like a lot of medication for him to calm down. And one day he was completely, he didn't respond. He wasn't even talking. He was nearly 3 days, probably said 1 or 2 words. He didn't manage to talk. He didn't manage to walk properly because of the medication. And then Dr. Palmer and Andy did a remote spirit release work. And what amazed me was the following day, he was another person. He was calm, he was smiling. He started sleeping because till then he was just sleeping because of the medication. He was still at the hospital. The psychiatrist, because they changed medication the same day, and of course they take all the credit about the new medication, but I cannot believe that they changed the medication one day, he's going to change so much the way he did. Yeah, and I think as a mother, as a parent, I think the work is done through Dr. Palmer and it also opened my eyes about, because sometimes you're so dependent of the word the psychiatrist tell you what to do and where it is, and you just see the illness on a person and you want just to get the illness up, and you forget that there's a person behind that. There's a person that probably they have other way to see things. And the way my son changed since the work, really, was till now, he's out of the hospital. He's been at home now for 2 months, and he's still doing well. I still take medication, but much less than he used to. But he hasn't shown any sign of be aggressive there he was before. He was very calm. But I think the point you put about how dehumanized is the psychiatric service, I think that is a big thing. Is for me, the shock was how they disconnect the person to the medication. They just see the illness and the medication, and they don't see the person. They don't see, what is.
Yeah, that's true a lot. Not just in psychiatry. There is a big thing in modern society where we believe that objectivity and I can't even say the word, but objectivity is the ultimate supreme being of where we should be. But we're emotional beings, we are subjective people. But the medical professions and other quarters of society, such as judiciary, etc., the law, they like to think they're elite and they put themselves out as being objective about things. But that disassociates them from any kind of human input, and it's wrong. It's wrong. We're each and every one of us emotional beings. We're each and every one of us.
And that is the basic things of a human, isn't it? That is what they forget about it. They forget that people that there's emotion, they said they're feeling, and and they just suppress more and more and more. Just to tick boxes that they are treating someone.
Did you say you contacted Terry?
Yes.
Yeah, well, at least you belong to those that do care for the children. Because there's a lot of people in Western society, if their children fall ill, of mental ill health issues.
And the point is, my son has been treating with the psychiatrist for the last 5 years. And the point was, he was deteriorating more and more and more. This wasn't improving. He started improving after contact Dr. Terence.
Yeah, good.
Like significant improvement. So for me, even if I knew, I didn't know much about the spirit release, is the changes and just tell me something, and it just that's really told me something about it.
I think it's important to point out as well that you and I have never met before today. Our communication has been by email. We didn't even speak on the telephone, did we?
No, it's
You
remains.
just sent email and asked if we can help. And I just needed some details about your son, his age and so on. And we did the work, didn't we, remotely? There are
Yeah.
serious researchers who spend an awful lot of time and energy, and they receive funding from, they're very fortunate that their research is financed and supported, researching into the nature of consciousness. Consciousness studies has become a very, very fashionable area of research. And you have a lot of organisations that are set up purporting to be investigating spirituality and so on. And you have people who are serious about researching what they call the paranormal. You have ghost hunters. And they're all out there looking for their particular piece of evidence to support the theory that spirits exist after death. There's a huge amount of activity going on out there in these fields. And we've discovered recently that people who are using electronic voice phenomena, experiments and devices to capture spirit voices from technology, it's become a huge plaything. And they're easily available on the internet, free, and you can use them on your mobile phone and invite spirits to talk to you like that. And we're now beginning to see the dangers of that, where people invite spirits to talk to them in much the same way that people used to do, and perhaps still do, I think, with the Ouija board. You open yourself up to these spirit entities. They come in and they take over and they inflict serious harm, and they can cause long-term serious mental and emotional damage. And this is all through, and I'm sorry, but I can't help using the word, through stupidity and ignorance. And a message that was given to us recently by a very, very old and ancient demonic entity goes all the way back beyond Egyptian times, back to Sumerian times. And this demon that exists and was attached to a person was attracted through EVP experimentation. And this entity said, you can't get rid of me, I'm too powerful, you're just not strong enough, but I will go at my own free will. And as it was leaving, it imparted some very, very valuable information to us. And it said, your kind are like children playing in a pool that's full of crocodiles. You just do not know the danger that you're playing with. So here's a very, very serious message from a demonic entity. And we thanked it, didn't we?
It was very friendly, actually.
It was very friendly.
Yeah.
Yeah. But it does what it does because that's what it does. And they exist, and this has existed for thousands of years. Thousands of years in our time, in our way of measuring time, but in the spiritual realms, time and space do not exist. There is no time. So when we're working with your son at a distance in our physical time and space, right? We're talking about remote at a distance, but in reality, there is no time and space. So when Andrew and I connect with the spiritual essence of your son, it is beyond time and space. And the entities that interfere with him, and those voices that interfered with you, are beyond time and space.
One thing that was was amazing because I gave very little information about my son. I think the only information I had given to you was that he's been diagnosed as being in the autismic spectrum when he was about 16.
Yes.
And then he was diagnosed with psychosis. And I think you asked about the medications taking. I think probably.
Yeah, I need
that
to know
was,
the medication because I need to print off a list of consequences.
But when Andy was talking to Jan, they identified that one of the negative entity my son had was in his throat, through the chakra in his throat. And I remember, and then he's saying that probably he had some speech impairment. And I didn't give it this information.
didn't give us that
and my
information.
son, my son always being treated with speech impairment. That was the first symptoms he had since he was about 2-3 years old.
And we didn't know that.
I needed to know that. And when you release a negative entity, my son he's always he still stammers a bit, but he's what I feel is much more connected to his own way of communicating, express himself than he used to be. Yeah, it's quite subtle, but I can feel the difference. I can feel things like he's more
More in control.
more in control, yes, more like self-confident about how to express, which still with difficulties, because that is been his condition since he was probably born. But that was very, very interesting. Probably all his problems been through his life originated from that.
You're providing us with evidence insofar as there is a difference between what was before and what is now after the intervention. What you're reporting today in a very, very short time is that there is a difference. Before you were hearing voices. Are you still hearing voices?
No intrusion so far, but I'll give it a good couple of weeks.
Okay. So the feedback I'm getting is
Yeah, I'll make sure I'll get some feedback to you.
the voices are not there.
At the moment, no.
Now to me that's evidence.
Yeah.
Okay. So whilst your parapsychologists and your EV peers and your ghost hunters are going out on their excursions, disturbing the spirits in a sense of fun, right, to collect evidence about the survival of life after death, are not really taking it very seriously, this is serious. Because this is evidence that spirits do exist. It's evidence that they can be very, very dangerous and they can cause distress and sickness, which is reinforced and prolonged and exaggerated by so-called health services that either intentionally or in ignorance really don't know what they're doing. It's a serious business, isn't it? And it's a serious business.
It's not necessarily the doctors and nurses on the ground. It's the way they've been institutionalised to think in a particular way. I think when we mentioned it earlier, there are policymakers of the oppression of the society that may...
And of course, there's a lot of money to be made out of antipsychotic medication.
I identified 3 different groups of spirits involved in Mike's case. We had one he called Scars in the Brain.
Mm-hmm.
We had Earthbound, several hundred of them, led by a spirit called Samantha. And at the end, we had a negative entity of some kind, which we didn't identify.
Right.
So which of that lot were causing the voices?
Well, first of all, I wouldn't say that there was several hundred in the background. I wouldn't say that. I also wouldn't say that there were any different kind of different associations. I'd say they all belong to the same group. Those scars in the brain are how I visualised what the voices were leaving behind, or how they manifested themselves. When I was in the state I was, I looked up at my head, whereas the rest of me seemed to be bathed in light. This was murky. It was muddy. It was dark. It was foggy. I couldn't see any light beyond it. The manifestations, the scarring on the brain, is what the voices, for me, how I visualise them. It's like there were entities sat on my brain, causing perhaps a lot of my thinking to be very negative by introducing comments, words, etc., etc., which they've done for the last 20 years.
So would you say that it's a form of symbolic representation?
I wouldn't. It's difficult to say because you're in a state where you're open to the possibility that that could be it, but you're also negotiating with the possibility that it is the spirit realm.
These voices had character because you described one of them as being female.
Yeah, definitely.
And the others were presumably male.
Well, there's about 2 or 3 that were female, but I've had for the past 20 years about 4 or 5, 6 voices. When I stood on that canal path and listened to them and turned my head where they were coming, about 2 or 3 females, about 2 or 3 males as well. You can't turn around because you can't see them. You can't log a definitive. I haven't logged them, so gone. The inflection of that voice is male A. The inflection of that voice is male B. The inflection of that voice is female C. It doesn't work that way. You hear the voices. You know the female voice from the male voice because the hertz zone that it operates in. I hear the voices, and there's about 4 or 5 distinct different ones. 2 or 3 female, 2 or 3 male. Now, when I was in that trance-like state, I envisaged them sat on my brain as some kind of scarring on the brain. That they were entities that were sat there. If you want a better word, like a cancer, like 4 or 5 different cancers sat in my brain. When Terry and Andy got involved, and they said, let the light devour them. Or that's how I envisioned them. The light was devouring that dark, kind of cancerous entity, for want of better words.
Now you see them differently, don't you?
Yeah, I sort of see images really.
This was an image,
Yeah.
but it's how I manifested them. I also saw on the top of my brain, like an eye, a dark eye.
Yeah,
which
you
was
describe
looking-
that.
Yeah, which was looking in. It was looking in and watching it all, but was coy. It didn't want to open up initially.
Well, I actually see, so if I'm looking at this discarnate spirit, so when we talked to Samantha, I could see her looking at you,
Yeah,
and
well,
I whispered into her.
But she was an
to say-
earthbound.
I could see Samantha.
Yeah.
I could see Samantha. When she turned away, I could see her head. I don't know how you visioned her, but for me, she had like blonde hair.
Long blonde hair.
Yeah.
Yeah. So she just looked at me as if to say, well, they don't realise that we can see
Where'd
them.
you come from?
Yeah, and it's almost like, now you're talking to me, but I'm talking to him, type thing. And that was when I think she stopped talking to you, and then she was obviously having a dialogue with me, effectively.
Yeah, she did turn away from me. I could see her head turning away and towards you, and that was before Terry introduced you. So you were already,
I
guess,
started
engaged,
to talk to
yeah.
her,
You always got, yeah. But differentiating, telling the difference between DFEs, dark energies, nexus you call them, and an earthbound. There is a distinct difference there. You visualise Samantha, a blonde-haired woman, as a person, as a human being.
No, that just came into my head.
Right.
I didn't visualise Samantha. I visualised the voices as being the cancers on my head, on my brain.
Which is
the
a
scarring.
different visual representation altogether,
Yeah.
isn't it?
I think when you were talking through it, you were asking, is there anyone left? And that's when Samantha popped up.
Mm.
Whether Samantha's connected to these scarrings, I don't know.
No, it shouldn't be. Because what we're dealing with here, my interpretation of it is I see, and because I don't see, so I can only imagine, I'm working on 3 different levels. There's the level of the negative entity, the DF, the dark force entity, which are non-human, destructive, mean only harm and ill will. And those are dealt with first. And it doesn't matter what form of therapy you are going to employ to help a person, whether it's psychotherapy, hypnosis, or any of the different schools, NLP, whatever mode of therapy is going to be applied, is doomed to failure. All the time you've got those DFEs in there, the negative entities, they will prevent anything from working. Okay, so that's the first thing that's got to go. The next level I work on is the earthbound level, and you don't have to be sick to have an earthbound. Anyone can be because earthbounds can be attracted to any of us. They're attracted by our own lives. And if you're a compassionate, caring, helpful person, a loving kind of person, then the lost earthbound will be drawn to you for that comfort, for that reassurance. And this happens to a lot of people, and they can be carrying an earthbound spirit without ever realising it. And I've come across quite a lot of those.
These particular earthbounds were quite clear that they were doing harm to Mike because they apologised for it.
Yes, well, what I was referring to there was the opportunistic earthbound that suddenly finds itself out of its body, doesn't know where to go, and attaches to a person with a light. But then you can extend that situation to the battlefield, to catastrophes, to natural disasters, where a lot of people suddenly die in a situation, and it takes them by surprise. There's a flash of light, they don't know where to go, they're lost, they're earthbound, but they were still attached to someone for a level of comfort, and that person will not know they're there. And without deliberately wanting to cause problems, their presence may have an effect. Like Samantha was apologising because she felt that she may have caused some distress, but it wasn't her intention to cause distress. It was just...
Yeah, I think as Richard says, so they know that they are taking your energy, and therefore that is having a negative effect on your medical.
But they don't know how to get out. They don't know how to be released. So, going back to what I was saying a moment ago, we deal with the deer feeds first, get them out of the way, and then we deal with the earthbound. And once the earthbounds are dealt with, if there are any deep-rooted psychological issues that need to be attended to, with dissociated parts, subpersonalities, because people, especially in childhood, who are abused in some way, they have a natural defence mechanism where they dissociate from the trauma, and it protects them from the pain. And that process actually creates dissociated subpersonalities that maintain an autonomous, conscious state. And as the person grows older and more mature, so that dissociated subpersonality remains there, the hidden child part, if you like. And a person can have several of these dissociated subpersonalities. Dissociated subpersonalities can also be brought from a past life trauma into this life. So after the DFEs are dealt with and after the earthbounds are dealt with, then we go into the deeper realms of the subconscious and negotiate and find those sometimes families
Indeed.
of hidden past.
Right. In Mike's case,
Would you know that?
we have very little detail about Mike's life.
Yeah.
We know he's been in the army, I know you've been in the Balkans, and you did mention PTSD at one point.
Yeah.
Are you suggesting, Terry, that Mike needs to have some more psychotherapy of some kind to deal with PTSD and possible, as you say, dissociated subpersonalities?
I don't know the answer to that question. I'm not going to assume anything. But the only person who would know the answer to that question would be Mike himself.
And I was just about to say, the way I feel at the moment, I'm going to run around Billy Go naked in the full moon, shouting freedom. If this continues, because I really am feeling no intrusions for the past 40 minutes, an hour. I think I'm going to go out and celebrate for a while, and then if over the next month or so I get recollections back that are PTSD issues, then I will address them.
Yeah.
But I'm just really, really glad at the moment. It's beginning to dawn on me. It's only about an hour ago.
It takes a little while to sink in, doesn't it?
Yeah, but I'm beginning to sense some kind of freedom for the first time in 20 years. So.
So that's the whole point of it, I think, and that's something for me personally, is that the reason, I put my time doing this is to help people, because there's a big gap between what's actually happening from a financial perspective with health services and social services and those sorts of people, and when we know this works and we know it cheap, as in there's no cost, there's no drugs, there's no medication, it's just people's time, and the difference you can make is phenomenal. You know, for me, it's a real shame that this hasn't kind of percolated into the medical system as yet, really, and it definitely needs to happen.
We should probably note for the record that in Brazil, these services are on the large scale, any institution doing this sort of work, and it's all offered free, as I understand it.
It is, yeah.
Is there any kind of statistics, tally sheets, or anything that's saying it's a success? Or are they finding it's
In Brazil,
in Brazil?
In Brazil, they've been using these techniques in institutionalised psychiatric hospitals since the 1930s.
Okay.
Now, why isn't that common knowledge here?
Has the evidence been correlated to suggest that it's working?
Oh, yeah.
Then it should be knowledge here.
Well, of course it should. Emma Bragdon is...
It's very limited in English, Terry, isn't it, as a problem? A lot of it's in Portuguese, it's not
yeah,
accessible
because
to the
it's
English-speaking world.
But every 2 years, the Brazilian scientists who investigate these, and the psychiatrists who investigate these methods, every 2 years they come to London to hold a conference to educate our doctors.
Yeah.
Every 2 years they do that.
But it's also clear from what I've read about Brazil is that they've also got an ongoing battle between the standard psychiatry services who completely rubbish all the spiritism work that's done and in fact instruct their patients not to go near anyone who does this kind of practice.
Yeah, well, that's self-interest, isn't it?
Well, it may well be. They may have all sorts of motives for it, but I'm saying that, you know, the battle is not won there in any sense.
No.
It's not a foregone conclusion.
It
There's
shouldn't.
lots of help, but you've still got to go and choose it. It may be in the face of instructions from the
It shouldn't be a battle. The way I think it should be, I think this kind of therapy should coincide, should run hand in hand, parallels, as opposed to both branches of, say, medicine, for want of better words, battling it out, science versus religion and all this and the other. If this is working, then surely it should be a branch of medicine or a branch of therapy that runs hand in hand with psychiatry. Because I don't doubt that I've got psychiatric problems, such as PTSD, possibly depression. But the thing is, it's easier to understand when you realise that a lot of it is triggered by this ethereal world.
Yeah.
The best example I can give, all these medicines that you take when you're a psychiatric patient, they ameliorate the symptoms. They stop things such as paranoia, ideas of reference, suicide ideation, things like that. But you still have those trigger factors. Now, in a PTSD case, a lot of it is down to the PTSD itself, which is very organic. But if you are suffering from ethereal kind of, voices, etc., intrusions, they are bound to trigger the ideas of reference. Because your brain, I might be thinking about going over there and picking up a phone off the table. But as I'm going over there to do that, if a voice comes in and says something different, I'm going to lose train of thought for a moment. And the way the brain operates, my suggestion is, it's like drop-down menus. One thought leads to another, etc., etc., etc. Now, the medicines, what they'll do is they'll stop that paranoia that can evolve from those triggers, but it doesn't get rid of the triggers. Now, this is why I'm thinking that this kind of therapy, if it works, it's proven it's working, if it went hand in hand with psychiatry and they opened up the doors and their ears and their hearts and their minds, then it could run hand in hand and they'd have a greater success rate than what they are doing now. That's my suspicion anyway.
It's almost a shame, I think, as well, is that people aren't paid for performance, really. Because if people have a problem and they take medication, it doesn't resolve the problem. If they weren't paid for that and you only paid for results, everything would turn around immediately, wouldn't it? Because suddenly you wouldn't give medication if it doesn't work. Some of the medication does work. If it doesn't work, you then try something different because you're actually looking for the result that you want rather than the financial reward that obviously comes with the material world, effectively.
Unfortunately, one of the results that psychiatrists are happy with is to keep crazy people off the streets and keep them from disturbing the rest of the population. So, I mean, the person, all you're doing is suppressing symptoms, for that person and keeping the rest of society happy. It's not curing anyone.
When all of society becomes crazy, what do you then do?
There's more and more people demonstrating ill health, which is to do with the mind or beyond, as the society
I
developing.
think, no, see the problem, I think the medicine in general, and I think the psychiatric services is typical. Yeah, how does it integrate the organic function of your body to your spiritual way? You know, if you start looking more together,
Yeah.
probably things, you know, get much better, because they don't consider the you know, your spiritual, your mental states. It's just you try to treat your body as you're completely separate from one to another. I think like education, even, and I'll talk about before the religion, even if you think about majority population, they might have some kind of belief or religion, but even then, when it comes to treat your body, the separate phase is like kind of the spiritual is one part and your body is another part. But if you start to look like how these things influence in the function or the organic function of your body, maybe things could be much better.
If there are any important comments that anyone would like to make, now would be a good time.
That if you're a sufferer, at the end of the day, don't give up exploring all aspects of what could help. Because I know I've been in the past suicidal, and I have made serious attempts to take my own life. It need not be that way. You just got to keep going until somebody or yourself steers you into something like this. At the very least, just don't give up.
What would you like to say to finish off with? Anything? Sarah?
And I agree, you know, I'm not certain that I'm parent, but I think I could tell the parents if they got children, their children suffer from mental health, is the same, don't give up.
Don't give
You
up.
know, look for different alternatives. If one are not working, try something else.
Yeah.
And I think you should, you know, look more carefully about, you know, the work Dr. Palmer and Angie been doing.
Yeah, without doubt.
I think it would help a lot of people. And I've seen a lot of young people, and my son was in a hospital, and, you know, majority young people there, and, you know, I think you could do much more for them. I think their life would improve much more if you had more, you know, look more carefully too.
Yes, I could add that I had depression for over 40 years, from the age of 18. And as Mike says, I went on looking and trying all kinds of different therapies. I mean, a huge long list of therapies I've been through. But I went to see another spirit release therapy earlier last year, and we worked through all this same kind of stuff. And now I'm off medication completely, and as far as I can tell, the depression is gone. It takes time to prove that. I mean, you need to leave it for probably 2 or 3 years to be dead sure that it really has gone. But, you know, I'm appear to be fine on no medication, which is complete change. Previously, I've been taking antidepressants for 25 years solidly every day.
Any final comments from Chen?
Okay, I disconnect again. Okay, so I just describe what I see. So I see a short Chinese man with his big long beard, moustache, his right down, hair tied back in a ponytail. And he's just bowing basically to say that from the spiritual realm, he would like to say that, well, thank you primarily to Mike, really.
Can I just stop you there
Yeah, of
and
course.
invite him to stand up and invite Chen to speak for himself?
Yeah, I can do that. Yeah, that's good. Good afternoon to you all. My name is Chen. I'm Andrew's principal guide and surgeon.
Hello, Chen.
Hello.
You're most welcome.
Thank you very much, Terry. As you say, it's very kind of you actually to invite me in. Andrew was, I'm sure, about to take all of the glory. He does do that at times. But of course, as you can see, I'm able to converse through his physicality, and I'm always there to speak with and enter into dialogue and sessions with. And I would just like to say to you all that, again, as we discussed, Terry, in the past, the book is only understood when it's written and read. And this is work in progress from our perspective, certainly from a spiritual paradigm. So the work that you all have entered into here, and you've all had experiences of your own from a spiritual, obviously a physical perspective, but this is instrumental in the change that will happen on this planet. So the things that you are doing, the group that you have set up, Terry, and the huge amount of time and your own energy you invest into this will pay off in dividends for humanity, people on the planet, from now really and for time to come. So I would just like to say that from our perspective, there's a huge amount of effort, time and work and energy being invested from a spiritual perspective. So all of you here have your own team, your own guides, whether you're aware of them or not, makes no difference. You're a physical person living a physical life, and you must engage in that physicality. But there is a spiritual realm, and I am testament to that realm. I'm speaking from it to you today. You can see it exists, and you're aware that this is real and it's happening, and we affect your life. We can affect your life positively, should you engage us and ask us to help you, or we can affect your life negatively, should we choose to. Obviously, I am working for a higher perspective and a higher light, if you like, and therefore my energy is positive, and the effect I have on young Andrew here and the people that we come into contact with would be positively aligned. There are negative entities and beings that exist around all of you every day, and they're here to cause problems and torment. And the societies that you live in should know they exist. They've been talked about for millennia. They're in your documentation. There is plenty of evidence inscribed into physical buildings, pyramids and such like that depict these entities. They show you the pictures of them. There are tablets. If you do your research, you will be very clear that there is another world that exists, and the negative aspect of that will interfere with your life, and people like young Mike here should not need to go through the traumas that he has been through for this length of time when this information is easily dissipated throughout society. So, young Terry, I will conclude by saying that I thank you all for your time and your investment into this process. This is merely the start, and from here the ball will roll, and we from the spiritual perspective will make sure that everything you all need to start to push this work forward will happen. You will receive finance, you will receive energy, you will receive the right people, and we will make it happen, and this will change humanity on this planet. And you will look back at some time, and you will smile and laugh, and remember that this information was given to you through love from a higher dimension. So I will say good day to you all. Please have a safe trip home, and spend your time using your thoughts wisely, because everything you think impacts your life, and you must think positive thoughts and engage with positive energies to have a fulfilled and positive life. Very simple. So good day to you all.
Thank you, Chen. Thank you very much. Welcome back, Andrew.
Hi. Sorry. Hi, so my name is Andy Porter, and obviously I've been here today working with Terry on behalf of the sort of Hearing Voices Help network and website that we've set up. So if I just give you a quick introduction to who I am really and what I do and my background. So now it's probably over 10 years ago, I was living in a normal house, non-spiritual, non-religious, didn't believe in anything ET-wise or negative or anything like that. So I consider myself to be quite normal, really, to a certain degree. And I was going through a bit of a difficult divorce, and I ended up meeting my new wife, now Jane. At the same time that happened, I moved house and started to experience a lot of negative problems. So lights would be on that I turned off, and I started to see shadows underneath doors. And one thing sort of led to another, to the point that every night really, when I was in bed, I couldn't sleep, and I was starting to hear odd voices, odd sounds, sort of banging, crashing on the hallway, and then the lights would go on and come off again. And I'd walk outside and everything would be okay, and I'd come back to bed. And this kind of got worse and worse, to the point that I started to think I'd kind of gone mad, as you do, really. So I started to look for help, and there was no one to help. So I got to the point that things were getting into bed with me at night, and the covers were lifting, and I could feel things rubbing up and down my legs and touching me, and I would jump out of bed sort of shouting and screaming and using expletives and that kind of thing. And I actually thought I'd lost the plot, really. Night it was so bad that I woke up and it was just gone 3 a.m, and I had a bed that was on a laminate floor, and the bed had casters. And I looked up and realised I was looking at the back of the wall, not the ceiling. I thought, that's like really odd. And then I realised the bed was like 2 foot off the floor, sort of thing you see in films and don't ever believe. I screamed, put me down, and a lot more expletives again. And the bed crashed to the floor, and then I did what all blokes do, really hid under the covers for the rest of the night, shivering and shaking, absolutely petrified. I thought, you know, whatever this is, it's going to kill me, basically. And I woke up in the morning after having more or less no sleep all night, and I thought it must have really just been a bad dream. And I looked at the bed as I got out, and the bed was off the casters, so the bed had moved to the right-hand side, and the casters were left in position, and I realised that I needed help. And at the time, my wife, my wife to be named Jane, she wasn't at the time, but she worked in a hairdressing salon in Launceston in Cornwall, UK, and one of the clients was a psychic. So Jane said, look, I'll speak to this psychic and see what she says. So obviously Jane spoke to Christina, this psychic. She connected to me in the house and said, yeah, you've got loads of things there. Screaming banshee, and it's basically possessed. And I was like, wow. And she said, but I can clear it all. And she did. And for about a week, I used to come home from work and nothing. No goosebumps, no lights on and off. I thought, wow, it's like amazing. And then, of course, it started again. And I realised that effectively something was kind of trying to get my attention from a spiritual perspective, and I needed to understand what was going on. And from that day onwards, I kind of invested a huge amount of time into buying books and spending time in Glastonbury in the UK, which is kind of like the spiritual club. People down there, some great books, and just learning about psychic protection and about spiritual entities and the paranormal. And one thing led to another, and I did a crystal healing course and then a Reiki course. And at the end of the Reiki course, the lady running it, Anne Oliver, said to me, do you know what, I've got this Chinese guy that's come in, who's a new guide of yours, and he's saying that his name's Chen, and he's going to work with you, and you're going to be a psychic surgeon. But I didn't really think anything of it at the time, particularly. And then, again, years went by, and I sort of joined lots of psychic groups, meditation groups, and Chen started to come through and actually talk to me, and I could then communicate with him. And I used to go to work every day in the car, and had like a good sort of hour and a half commute each way. And I used to spend my time talking to Chen and trying to get that connection to be really strong. So I'd turn the radio up every day a little bit louder and see if I could lose the connection or maintain it. So that was how I sort of learnt to connect to spirit and talk to Chen. And then we set up a website, and I started to offer myself as a psychic surgeon. I had physical problems, and Chen would take over my body and work through me. And that worked that way for a good 4 or 5 years. And now recently we've moved into people that have got mental illness type problems, schizophrenics, people hearing voices. And I started to realise that this was an area that I'd seemed to excel with by default, really, not that I kind of chose to do that. And I could connect to the entities or the discarnate spirit that are with people and talk to them and ask them to leave. And if they wouldn't leave, my guide Chen and his team would remove them. And then the people would report back that the voices have gone, and they'd feel good. And I thought, okay, so, you know, this has kind of been presented to me, even though I haven't chosen to go this way. So 2 or 3 years ago, Terry made contact with me through a website, and we've sort of been friends since now of actually setting up our own website called hearingvoiceshelp.com. And we're starting to work with people that have got mental health, schizophrenic problems. Not to say that we can help all of them, but the ones that we can help, we do. And obviously today, working with Mike is sort of proof in the pudding that in an hour, for a guy that's had 20 years of voices, been through the system, been sectioned, tried to take his own life, we can make a difference and stop those voices. So it's worked really well. So I'm really pleased. So I think now we're like 8 to 9 or something. So we're trying to hold back a little bit because we can't really cope with a sort of deluge, and this is a difficult thing, isn't it? Is that there's only 2 of us, and I've got a normal job, so I'm working like 5 days a week type thing. Terry's obviously retired, so he's got a bit more time, but trying to fit a lot of people in is going to become quite tricky. And that was why we were hoping that we could use this to teach the techniques to other people, and that other people can set themselves up doing the same things, and then just use us for reference and say, right, this didn't work, what have we done wrong, or what could we do? And I can connect and have a look and think, right, yep, you missed this, or So the intention is not that we're going to be the kind of like central focus to do this. It's just that we can hopefully provide the techniques that then get pushed out to other mediums and psychics and people like Terry that can then take it and offer it as a therapy. So Equilibrium can have it on their board, for like whatever, as one of the things they offer. If you're hearing voices come here, someone will sit down with you and go through looking to see what's attached, talk to it, get rid of it. I used to have the problem, because obviously when I was learning to do it, then I was getting this flood of, so we'd go and sit in like a pizza. Jane and I'd be out for pizza one night. In fact, we were next to her one night that I remember. And I remember seeing people coming through the door, a lot of children, and walking right up to us. And I'm sort of talking to her, and I'm looking at these people, and we're eating this pizza, and it started to get really cold, because of course, spirit brings cold in, or their energy makes things cold. You feel the cold. So Jane looked up and said, "But God, it's really got cold in here." And I said, "Yeah, I know, there's like 50 people stood next to her." And she's like, "Wow, can't see anything, you're crazy," type conversation. So I just had a chat to some of these children and said, "Look, they were telling me they'd followed me all around Exeter, followed my energy around, and we all just stood in Pizza Express." So I just said to Chen, "Can we help them?" And just opened the door, and they all literally went through, door closed, and the room warmed up instantly. And it was like, wow, that's really interesting. So as part of kind of my journey, I've needed to learn these little techniques of how to deal with this kind of like intrusion, because it becomes an intrusion, because when you can speak and see them, they don't go. And that's the same problem that Mike's obviously had. He's got things talking to him all the time, and they won't go unless you kind of need to make them and know how to do that. And it's part of the learning curve to a certain degree, so really. Yeah, so kind of I've got used to it. But so the way that I work for myself now is that when I'm in my normal conscious self, which is like 90% of the time, I'm just me as you would be you, just doing my normal things, driving the car, listening to music. But then when I want to talk to Chen, I just do a quick bit of grounding, a quick visualization of protecting myself, then request to connect to him. And then I get a voice in my head and we just have a chat, like we're sort of saying. So normally if I'm in the car driving somewhere, we have quite a long chat about the world and things, and not particularly spiritual things, just normal stuff, as though you're sat with your friend in the car having a chat. It's just that my friend no one else can see. And I think that's the interesting point as well, is that people that are mediumistic and psychic are only one step away from being like Mike, except Mike is talking to things that he can't control and therefore cause him a negative problem, and hence you need to see a doctor and you get sectioned and that kind of thing. Whereas we all hear voices the same, just that our voices are positive and they don't, there's a certain boundary they don't encroach on, and we can manage that conversation the same as you would do in a normal sort of physical reality. And that's the key, really. If people were taught how to protect themselves and learn more about spirituality from school, everyone could do this, because it's not rocket science at all. It's just that people aren't taught how to do it, and then when you hear a voice that you don't know how to control or manage, then you end up with these problems. So basically, Terry and I have set a new website up called Hearing Voices Help, and the idea is that, my guide Chen asked me to set it up and gave me the name. I checked on the domain, it was free, so we bought the website, and because I work in IT, I've actually designed, if you like, and Terry and I have set it up, and we've got it set up in the way it is. And the idea is it's going to be there to help people that are hearing voices. So the intention is when someone types in hearing voices, help, as in help me, we're hoping that our website will come to the top of that list, and it will just give people an alternative view really on the help that's available and the things they can do. Because we've both looked, and there's hundreds of websites on hearing voices from Mind and from the social services aspect, and obviously every country has a mental health kind of area, so they've all got their websites and they've all got their help. But unfortunately, all it actually does is take them into the kind of the normal medical establishment route of tablets and medication. And there isn't really anyone talking about the fact that if you can remove the spiritual entities connected to someone, then the voices go. So not that this works all of the time, but for certain numbers of people, and obviously for Mike that we've sort of displayed today, if you can get rid of the attachments, then the voices stop. So we're hoping that the website is going to become the kind of go-to place for people that are looking for an alternative angle really. And like Mike, have been through the system, he's tried all the medication, he's had the therapy, it hasn't worked. And we're hoping that we can get to a point that we are offering a different view on it, with a view to actually helping people to get better. Because that's the whole point, is that Terry and I have set this up without funding from our own pockets, and we give our own time, and we're not paid for it at all. So it's not coming from a make some money perspective, it's coming from a we can help people, and we've both had families and people in our lives that have suffered with these traumatic effects, and therefore we're keen to make a difference. And of course we know it works. I think really that with the website behind us now, and our YouTube channel and our own websites, we know that the things that we do does actually work. It's just getting other people in society to understand and to look for that alternative help really. I've got this little dilemma really, because I work in IT. Every time someone finds out what I do, I lose my job immediately, because people are scared that when they're going to die and all this stuff, which it's like spiritual people don't know that. Mediums and psychics don't know it. I don't sit in front of someone and see like your life path and think, yeah. But of course, the population seem to think that if you're mediumistic or psychic, you know all this stuff. But as I was trying to explain earlier, I choose when I talk to Chen, and he chooses what he tells me. If I don't ask him for information, he won't tell me. And even if I asked him for information about somebody, if they haven't given their permission, he still wouldn't tell me. So, it's no different from talking to your friends, really. It's the same kind of setup and configuration. But I kind of got to the point, I thought, okay, everything's happening on Facebook, and I've chosen purposely not to put myself on Facebook because it doesn't work well from a kind of normal job perspective. Yeah, but it does, and I've worked for some really some good managers in big companies, that are very well respected. And as soon as they find out what I do, you get called in, projects being cancelled, or the resources funding's disappeared, and you're packing your bags the same day normally. So I've got to the point of trying to keep the spiritual world away from my normal physical IT world, on the basis that they don't actually interact very well. My view is that this is going to get bigger, and we are going to take this somewhere quite positive, and at some point it will probably become my normal job really, or normal career, So I set this Facebook website up, and I've started to post a few things, and the idea was just try and grow a few friends, and then when we do these sort of events, I can then push it out and say, look, this is happening, anyone want to come? So at the moment Terry's got 2 or 3, I think, different Facebook pages. He's got his book, his own personal one, and then he's got the Dr Terence Palmer one. So we didn't want to kind of spread it too wide, but the idea was that the Hearing Voices Help would become its own autonomous thing, really. And so a Facebook entity called that people can contact us on it, and then we've got someone that can reply. Because of course at the moment as well, we try not to make it too popular on the basis that there's only 2 of us running everything from behind the scenes. And obviously if Terry starts to get lots of interest and people mail in, these days with social media, everyone expects to reply on my own website. As soon as I get busy, I end up with like 30, 40 emails, and I've got to reply to each one individually. And then you get a whole load more questions come back, and you can burn through time really quickly. So that was why, because I used to actually talk to people, as in the old way of doing things. But I just found that everyone would want an hour's conversation, and no more or less they'd want to talk about me and how I got into doing this stuff, not about their own problems. So if you've got like 40 people a day mailing you can't have 40 hours of conversation. So I got to the point I kind of shut off all phone conversation, just moved purely to email, on the basis that you know, I can write emails quite quickly and you can get the communication very quickly. And ultimately for me, the way that I work, I don't actually need to speak to anyone anyway, because I just connect to their energy and do the work that I do. So I don't actually need to get into a big long conversation. Just intent, really. So my intention when we work with a client, Terry doesn't give me their name, just a client called X and Mr. or Mrs. normally. So I just bring up a picture of a female or male in my mind, and then with my intent, I just visualise connecting to that person.
So you have nothing else.
So I have no hair, you know, like a lot of mediums need clothing or hair or photographs. I find I don't need anything like that at all. Just purely the intent to connect to the right person. I can hit their etheric field and then I can feel what they're feeling as well. So Terry quite often will say to me, you know, how is this person feeling? Like I say, I've got the jitters, I feel like I've got a coffee rush, or feel really depressed or angry or sad, or feel like I want to cry, you know, so and it just kind of happens, really. And of course, my guides are sat in the background, so I'm talking to them, checking that, yeah, I've got the right person, yeah, we've got, you know, the problem that they've been presented with. And then when we finish, Chen will normally give me the okay that they're happy from a spiritual perspective that we've done what we need to do for that session. So for me, really, I kind of have the easiest job, so I don't really have to do very much other than listen to Chen and repeat what he says and just go through some visualization and you know, the psychic aspect that sort of has taken me like 10 years to learn, but now it's just like sort of tying your shoes, really. It's kind of just happens. Yes, when we first sat down, I just basically had a quick look around his etheric to see what was there. So I could see at least 3 negative entities that were connected into him. We call it corded in. So I see like a cord, almost like a hose pipe that connects from them into his etheric field. And then I could see a whole host of what we call earthbound discarnate spirit in the background. So they're not really, they don't present themselves to me as being connected to him, but they're with him. So I know that we need to talk to them. And then from there on in, for me, it's just a case of normally removing the negative entities first and then speaking to the discarnate spirits. Normally one comes forward as a kind of, almost like a host presenter really, and they'll talk to me and the rest will just follow. It's just a case of inviting them to move to the light and move on. And then what Mike would feel immediately is this huge sense of like uplifting relief. Almost like, you know, if you've been walking around with like a breeze block on your back, it's weighted you down and you take it off, you'd go, oh, great. And I actually watched him and he actually lifted his neck at the time and he coughed and I thought, yeah, he's noticed the actual physical feeling of that. So and that's the thing really, is that things that happen to you in the etheric actually change your physical feeling. So you know, you can, if people visualize, well, there's certain occult techniques that you can use, you can do things to people without them knowing that actually cause them physical pain. So it's a powerful area, really. Yeah. And you'll find now that going home, his energy will suddenly come back, well, by now already, and he'll actually be feeling like he's living again properly, and he's got energy to do things, and that's what these things do. Negative entities and discarnate spirit, effectively, you know, they kind of connect to you and then they siphon your energy. And this, I think, is probably where the idea of sort of psychic vampirism came from, like years ago, whereby if you've got something connected to you, not taking your blood would give you the same effect because you'd feel lethargic and tired. And this is the same kind of concept, that you've got an entity vampire in your energetic field and taking your energy from you. And then, of course, you're a physical person, physical being, so you'll feel that change. Had it a lot of times, so I know exactly what it feels like, and this is, I think, is the thing really. So I'm kind of lucky in a way because I went through quite a difficult, traumatic experience. That's part of my spiritual path. I can understand exactly what people tell me and how they feel because I've been there myself. It was, you know, the most horrendous thing ever in my life. But I look back now and think, well, that was the best teaching I could have had, really, because, you know, I've been there and been through it all. So when people talk about, you know, these things and how they attack them and what they do mentally and the thoughts they give them and that kind of thing, I know exactly where they're coming from because I've experienced it myself. So it kind of is like a blessing in disguise.
Okay, the first thing I'd like to say is that I don't want anyone to run away with the wrong impression or an illusion of what I am. Or so first of all, I'm going to just say, well, I'm not. I'm not a medical doctor. I'm not a psychiatrist. I am a psychologist. I have a PhD, which gives me the title of doctor, and my doctorate is in a subject related to the psychology of religion and the psychology of religious belief. It's an academic qualification, not a practical qualification. And my doctorate was awarded for my thesis on the work of Frederick Myers, who was one of the founder members of the Society of Psychical Research in 1882. So why do I have a doctorate on the work of Frederick Myers? And why do I do what I do now? This is a very, very difficult question to answer because the answer involves a journey that has taken more than 20 years to cover. My investigation into these phenomena began more than 20 years ago when the economy collapsed and my business in the distribution industry, in computers and in exhibitions and conferences, collapsed and vanished in a cloud of dust overnight when Maggie Thatcher's policies failed. And I was sitting on a beach on the island of Crete, and I was saying to the universe, what do I do now? And it was by asking that simple question, or to put it another way, dear God, what is happening here? I need answers, I need explanations. And then the strangest things began to happen. I began to get the answers I was looking for. And I began to have a series of what could perhaps best be described as mystical experiences, where I was shown things I did not understand, and I discovered and I was shown that I had a natural healing gift that I did not understand. And I could take pain away, physical pain away from people miraculously without understanding how or why it worked. So I needed to find out how and why it works. That was the beginning of the journey. And where we are today is that I work with people who come to me for help, who hear voices. They may be diagnosed with schizophrenia or post-traumatic stress or any number of psychiatric diagnoses. And because I'm not a psychiatrist, I can't challenge those diagnoses. I'm not qualified to do that. And I'm not qualified to treat people because I'm not a medical doctor. So what do? I access their spiritual consciousness. I access them at a spiritual level. I invite them to go into an altered state of consciousness that some might describe as a hypnotic trance. Some might describe as an altered state of consciousness. Some would call it a meditative state. But whatever name you give it, it's not the normal everyday consciousness that we use as we go about our everyday business. It's a slightly shifted state of consciousness that enables us to see and perceive things that our normal everyday waking consciousness can't perceive. So when a person's hearing voices, it's normally assumed by medical science and psychiatry that these voices are hallucinations, that they're created in the imagination of a defective brain. And the way to deal with them is to inject an antipsychotic drug or some kind of chemical compound that will make the voices go away. That is the common assumption of medical science. But what I've learned through practical experience, that is not the case at all. These voices are real. They come from a source other than the creative imagination of the individual. They come from an external origin. And they can be dealt with. It's a very, very simple process that I can demonstrate very, very simply in 20 minutes to anyone. And what we've been doing here today is to actually demonstrate live with a man who's been hearing voices, not just hearing voices, he's been persecuted by a gang of voices for 20 years. And it's driven him to the point of suicide. And he came here today to be relieved of those voices by me, by a man who is not a medical doctor, not a psychiatrist, and has a PhD in the psychology of religion. And after 20 years, the man no longer hears voices. Thank you for listening.